Well, not just delivering good quality family planning would be a reason, but because we can remove some of those barriers for your access. So finance is a consideration for many clients. Transportation, accessibility of appointments. So you have a clinic that has the availability of an encounter or a visit when you're available to go, and warm, friendly, invitable, non-judgmental environments with your clinic where everyone in the clinic has a basic understanding of family planning. I think with the approach that we're taking with is the hands-on consultants going to visit the centers and discussing the individual needs of those centers are really going to help improve the quality of family planning that's provided, because we're going to help them better understand what the needs are of their area and how to remove barriers for patients by finding out what their barriers are to delivering the care. Because many times it's not just about a knowledge base of a provider. They may have a lot of knowledge about it, but actually delivering a specific service like IUDs or Nexplanon is not something that has been facilitated in their clinic. Same-day access takes more than just the provider to know about it to facilitate that service. So I think we have an opportunity here to really improve that. So because the providers themselves are using those methods and they trust those methods, they are more positive about discussing it with their patients. I think it went up by 20% in OBGYNs just in the past 5 years. So I think that's one reason, but I also think because of the changes in how people access and afford healthcare, it became available to them. Because we have Title X clinics where on a sliding scale, they can now afford something that was completely out of their grasp before. Because it's not the pennies on the day that you save for choosing an IUD over paying for a pill, right? It's not the pennies on the day, it's the upfront cost. And people had to save that in order to get it. Insurance companies are covering it now without question. That's excellent. Making sure that we have it available for people that don't have insurance or can't pay, huge difference. To change the way we approach contraception is important. Giving people agency or control over whether they become a parent or not is important. So if they're not going to look at it in that direction, then we need to be having the conversation that's going to help them think that they could even possibly control it. Many people don't. The approach to contraception or planning a family is not a part of how they were brought up. And so asking people if they want to have a goal can just change the whole conversation. Not about what a woman's going to do if she has a pregnancy, but how can we assist people in planning those things and make it worth planning, right? Make it worth planning. And everybody, not just heterosexual females.